Cause-specific mortality includes HIV, AIDS, hepatitis B, tuberculosis, parasitic infections, malaria and malnutrition. Mental health also plays a big role in the health effects of refugees, because of the traumatic experiences that they experience in terms of war, torture, and rape. It is hard for them to cope with that stress as well as moving away from their home. When refugees enter their host country, they are screened for diseases, and given a full health assessment. Adult refugees, 21 and older, without children are eligible for the Affordable Care Act. But the ACA has limitations, like being uninsured has a fine in North Carolina. For those who are not eligible for Obamacare because the premiums for it are too high, may be able to apply for their state's Medicaid insurance. Medicaid is strictly distributed in North Carolina and is not necessarily a default to those who cannot afford insurance. Although health insurance is more difficult for adults to get, children are eligible for the Children Health Insurance Program and is available for them for many years. As a last resort, refugees may be eligible for the Refugee Medical Assistance, which is an insurance coverage that lasts 8 months from their entry date. A study concluded that due to the high burden of chronic diseases in the refugee population, refugees would greatly benefit from the expansion of health coverage to assist with their conditions. Another reason for the exclusion of refugees and the expansion of health coverage is their limited English proficiency. Cultural sensitivity is important when treating refugees because many of them do not trust doctors as well as the translators they use for the doctor due to past traumatic experiences. There is a lack of insurance, proper housing, language barriers, and community resources in refugee communities. There are 2 reasonable solutions. 1. To expand Medicaid coverage to those who are under the coverage gap. Or 2. Amend the current programs in place to cover all refugees for a longer period of time or until they legally change their status.